Americans spend over $1 billion a year on fish oil supplements, most of them buying one specific promise: a sharper mind, a healthier brain, some protection against Alzheimer's as they get older. But a major 2-year study published this year just tested that promise directly. And the results are not what the supplement industry wanted to hear. Omega-3 fatty acids, especially one called DHA, play a real role in the brain. They help build and maintain the connections between brain cells, the very connections that thinking and memory depend on. That's the science behind the marketing. Take a pill, raise your omega-3 levels, protect your brain. It's one of the best-selling supplement categories in the country. But does it actually work? Researchers at the University of Southern California's Keck School of Medicine set out to find a real answer. They recruited 365 adults, aged 55 to 80, people who rarely ate fish and who carried real risk factors for Alzheimer's. Nearly half of them carried the APOE4 gene, the single strongest known genetic risk factor for the disease. Participants were randomly assigned, double-blind, to receive either a daily fish oil supplement or a placebo. Here's what made this study different. Previous fish oil trials had failed to show a brain benefit too. But supplement advocates always had an explanation. Maybe the omega-3 just wasn't reaching the brain. So this time, researchers checked. They measured DHA levels directly in the cerebrospinal fluid, the fluid surrounding the brain and spinal cord itself. After 6 months, DHA levels had risen by an average of 17%. The omega-3 was getting there, and yet, over 2 full years, nothing changed. No improvement in memory, no improvement in general cognitive performance, no reduction in the brain cell loss that's linked to Alzheimer's disease. The omega-3 reached exactly where it was supposed to go, and it simply didn't move the needle. We all wish there was a silver bullet for preventing Alzheimer's, said Dr. Hussein Yassin, the study's lead investigator. But our findings showed that fish oil supplements do not appear to protect brain health. It's a blunt conclusion from someone who spent 2 years testing the opposite hypothesis and came up empty. This wasn't the first study to find fish oil doesn't help cognition. But it was, by design, the most rigorous. By directly confirming the omega-3 reached brain tissue, it closed off the standard defense used to explain away previous negative results. There's no more room left to say the supplement just wasn't working hard enough. So, where does that leave the search for brain protection? Researchers say the focus now shifts away from a pill and back toward overall diet, exercise, and lifestyle, the factors that consistently show up in healthy aging research. Omega-3s still matter for the body, but as a standalone shield against cognitive decline, the evidence, at least for now, says no. If this one made you rethink your supplement shelf, subscribe, because we're only getting started on what science actually says versus what marketing wants you to believe.